Thank you for joining us today as we look at continuous glucose monitoring. First, we will start by discussing the importance of this topic. The current number of Canadians diagnosed with diabetes is approximately 3 million individuals. According to Diabetes Canada, approximately 9% of diabetics are type 1 and require insulin administration. The other 90% are type 2 diabetics who may or may not require insulin based on their specific needs. Gestational diabetes has limiting numbers as it affects only pregnant women and typically resolves post-pregnancy. Generally, the incidence is less than 1%. All three types of diabetes require glucose monitoring. The use of continuous glucose monitoring can eliminate the need for finger sticks, manual glucose tracking, it reduces the needed supplies, and it can provide a sense of freedom. Continuous glucose monitoring can alert to highs and lows, allowing the patient to make corrections in the moment and provide this information to their primary care provider. This gives an indicator for the HbA1c results and current management to help reduce diabetes complications. Meet Jane. Jane is a 28-year-old female who has been managing her type 1 diabetes since she was 6. Recently, Jane's blood glucose levels have been highly variable, and she believes it has to do with the birth of her new baby. She is not eating well and is having many nighttime disturbances for breastfeeding. Jane is visiting her family doctor today to find out what she can do to improve her blood sugars. After Jane tells her doctor about her concerns, he asks Jane if she would like to try a continuous glucose monitoring system. Jane has always managed her sugars using fingerstick testing and insulin injections, and she asks the doctor how continuous glucose monitoring might better control her sugars. Glycemic variability is defined as the degree by which a patient's blood glucose level fluctuates between high and low levels. The risk of health-related complications from diabetes increases with glycemic variability and the amount of time spent in hypo and hyperglycemia. Thus, glycemic monitoring is acknowledged as the cornerstone of diabetic care. Continuous glucose monitoring offers a proactive approach to glycemic control that is unattainable by conventional self-monitoring of blood glucose and hemoglobin A1c data. When blood glucose is trending down, timely identification through continuous glucose monitoring allows patients to take action to prevent hypoglycemia. As blood sugars trend up, patients can modify medication, activity, and food intake to bring their sugars back into the target range. Continuous glucose monitoring is often considered for patients with severe or nocturnal hypoglycemia and those with hypoglycemia unawareness, as device alerts are transmitted to the individual or a designated carer to prevent life-threatening events. Over time, individuals with poor glycemic control can experience a number of long-term health complications, including microvascular and macrovascular pathologies, inflammatory changes, and increasing insulin resistance. These changes tend to be more prevalent in those with low socioeconomic status, have poor dietary habits, a sedentary lifestyle, have limited accessibility to primary care, have low treatment adherence, and reduced health literacy levels. While continuous glucose monitoring does not in itself control glucose levels, the technology can mitigate the negative impact of many risk factors for long-term complications by improving self-management in a cost-effective manner. In addition to reducing long-term complications of glycemic variability, continuous glucose monitoring can help patients achieve short-term treatment goals, decrease anxiety related to highs and lows, and improve quality of life. In contrast to HbA1c data, which reflects the average glycemic status over a 2 to 3 month period, continuous glucose monitoring data allows for in-depth analysis of daily glycemic trends related to specific variables such as time of day, stress, food choices, and exercise. This information is beneficial to both the patient and the healthcare provider for treatment planning by providing insight into patient-specific needs such as lifestyle changes, diet modifications, and pharmacologic adjustments that can help patients achieve better glycemic control and more independence. Jane agrees. The fluctuations she has been experiencing with her sugars is taking a toll on her mentally and physically, but she is still unsure about how continuous glucose monitoring will fit into her lifestyle. Jane enjoys being physically active, and she worries that the sensor and monitor will be difficult to use and will get in the way of her favorite activities. What information can we provide Jane to assist her with this decision? A continuous glucose monitor includes a small disposable sensor placed under the skin, typically on the arm or abdomen. The sensor measures the interstitial glucose level, which is the glucose found in the fluid between the cells. Blood glucose levels are tracked every few minutes throughout the day and night, and a transmitter sends the information to a compatible receiver. The monitor may be part of an insulin pump or a separate device and can be carried in a pocket or purse. Some continuous glucose monitors send information directly to a smartphone or tablet. There are several models available, each with its own unique style and features. Advancements in continuous glucose monitoring technology now allow users to receive blood glucose levels directly to their monitors in near real time. Many monitors display numbers and graphics that are easy to read and interpret. The user follows the information on the device to maintain target glucose levels. In some cases, the device will advise the user to verify the reading with a finger stick. Although very few continuous glucose monitors have decision-making capabilities, some of their sensors can be linked to insulin pumps that tailor dosing based on demand, mimicking the metabolic processes of the pancreas. These sensors track and store glucose trends over longer periods as well. Trends can then be uploaded into an app that patients can share with their care providers. Having ongoing information readily accessible to the patient and provider improves diabetes self-management and allows for timely adjustments to medication, food intake, and activity. Continuous glucose monitoring is a relatively non-invasive way for diabetic patients to stay informed about their glycemic values while minimizing the frequency of uncomfortable finger stick testing. Their sensors are replaced every 7 to 14 days and can be worn during bathing and activity. Calibrations of the device require finger stick testing and will vary in frequency based on the model, but overall, patients experience fewer needle sticks with continuous glucose monitoring. The convenience and portability of the sensors and receivers contribute to treatment adherence as patients are more likely to adopt technology that offers ease of use and lifestyle compatibility. Most models provide users with multiple operating system options to ensure the device can be paired with devices the patient already owns. Site selection gives patients the flexibility to wear different styles of clothing while keeping the sensor discreet, which can help offset body image concerns. Studies have found on average that those who monitor their blood glucose levels more frequently can lower their HbA1c level by about 0.3%. Mobile devices and pumps are equipped with alarms to notify the patient or a designated person of impending critical glucose values. This feature gives patients and families peace of mind, knowing that extreme glucose levels can be identified and corrected, even when the patient is asleep or unconscious. In fact, continuous glucose monitoring is approved for use in pediatric patients, which has been shown to reduce anxiety in parents who can now monitor their child's glucose levels remotely. Patient-generated data through continuous glucose monitoring can be linked to digital technology shared by their healthcare provider. Individualized data is used for diagnostic purposes and is the basis for decision-making and patient counseling. In order to maximize the benefit of this data, sensors should be worn continuously, and patients should receive teaching on the proper use of data collection technology. On a broader scale, databases containing continuous glucose monitoring information are being used to improve intuitive algorithms that will continue to advance this technology at a global level. With high patient adherence rates, continuous glucose monitor developers propose new algorithms will be able to identify individualized blood sugar patterns for each patient. Accumulated patient-generated data combined with data-driven feedback from medical practitioners is being used to enhance the software found in these medical devices. Sensors are being tested to collect blood glucose levels through contact lenses, sweat, breathing, and tattoos. Information collected about patients' eating habits, sleep, and exercise contributes to artificial intelligence found in medical device software. Future integration of algorithms with artificial pancreas technology promises to improve the quality of life of diabetic patients worldwide by allowing less invasive technologies to make treatment decisions using insulin and glucagon based on predictive needs. Additionally, continuous glucose monitor metrics are being used to test the pharmacodynamic profiles of newer glucose-lowering agents and long-acting insulin analogs to promote better glycemic control and reduce glucose variability. Jane is impressed with the information her doctor has given her so far about continuous glucose monitoring, especially how the information she provides to the system can help others with diabetes in the future. She understands that the sensors can be worn during activities and bathing, and that she can monitor her levels right on her phone. Jane has been trying to sleep when her baby sleeps, but is often worried that her glucose levels may drop throughout the day if she is not eating well. The alarms provide Jane with a feeling of comfort. Jane agrees to try continuous glucose monitoring. After seeing the doctor, Jane has the opportunity to ask her nurse more about how to use the technology. Was Jane provided with the correct information? Do you think continuous glucose monitoring would be appropriate for Jane? The use of continuous glucose monitors has been shown to improve patient health outcomes in both inpatient and primary care settings. In the height of the COVID-19 pandemic, many hospitals shifted to continuous glucose monitoring in their ICU settings to decrease close patient interaction. In a study by Falds and Associates, it was concluded that the continuous glucose monitors were equally as accurate as point-of-care capillary sampling. Their use decreased staff workload, and they reduced the risk of virus transmission. Continuous glucose monitors were highly praised by nurses in the study, indicating that this type of monitoring has a place for inpatient settings. However, as hospitals adopt policies for continuous glucose monitoring use in inpatient settings, comprehensive training on proper use and ordering is necessary to ensure patient safety. Nurses have a duty to ensure they have the necessary knowledge and competence to provide patients and their families with adequate teaching surrounding continuous glucose monitoring usage, troubleshooting, integrated technology, and diabetes self-management. With many different monitor models on the market, specific features and designs for each system require ongoing learning. Nurses should follow organizational policies and refer to the manufacturer websites that provide resources for frequently asked questions and troubleshooting. Continuous glucose monitoring is greatly supported in the field of endocrinology. However, due to lack of access, most patients receive their diabetes care from primary physicians who may not be well versed in continuous glucose monitoring implementation. To maximize the benefit of these devices for patients, nurses must recognize the value of collaborative care. Many continuous glucose monitors offer remote monitoring features so that family members can receive alerts about significant glucose fluctuations. It is imperative that designated individuals receive the necessary teaching to intervene appropriately. Additionally, members of the interdisciplinary team, such as physicians, diabetes educators, dietitians, social workers, and pharmacists should be involved in care planning to ensure patients and family have a strong foundational knowledge of disease management while using this technology. Frequent monitoring has the potential to improve glucose control and patient autonomy. Therefore, considerations regarding medication, lifestyle, diet, and funding options may be better addressed through collaborative means, drawing upon the expertise of each team member. Continuous glucose monitoring has been approved for use with pediatric, adult, and geriatric populations, recognizing that health literacy levels, technological competence, and individual treatment goals will be highly diverse among these varying age groups. Nurses must be equipped to tailor their approach to meet the needs of all patients. Continuous glucose monitoring use for pediatric patients allows children to participate in a greater range of activities while alleviating the parental stress associated with glucose fluctuations. Pediatric patients may require focused teaching on the importance of treatment adherence and continued assessment of treatment goals throughout their developmental stages of life. Geriatric populations, on the other hand, may express reluctance to use integrated health technology due to a lack of experience or physical and cognitive impairments that prevent them from using the device. Nurses must assess patient-specific factors that can impact successful usage. After the nurse speaks to Jane, she understands how to select and clean her sensor site, apply the device, and connect it to her smartphone. Jane demonstrates a good understanding of how to interpret the graphics on the screen and what to do if her levels are high or low. Jane is happy to discover that the continuous glucose monitor will be covered by her health insurance, as she has been spending a lot of money on diapers lately. Jane asks the nurse for additional information about the device to share with her husband. The nurse provides Jane with a pamphlet and encourages her to reach out to the clinic if she has any concerns or questions regarding her new monitor. Follow-up is scheduled for the following week, and the nurse notifies the diabetes educator of the care plan so that she can also see Jane before discharge. What other information might Jane require? Do you foresee any barriers to usage? Thank you for joining us today as we discuss continuous glucose monitoring, how it ties into informatics, and its importance to nursing practice. Consider the questions that were posed to you about Jane. How might you approach this topic with her? Is there any information that you feel was left out or lacking? Do you think continuous glucose monitoring could be of use to her or patients like her? How might you have to modify your current practice to support the usage of these devices?